Natasha Smith-Thomas, and welcome to today's COVID-19 update for Thursday, November 18, 2021.
So right now, we're following our protocol for international travel, and that is once people can produce a document to say that they're fully vaccinated, along with either a PCR or antigen test, they'll be allowed into Guyana. So we have reopened all our ports of entry following these guidelines, and Brazil is no exception. So in terms of the cases that we have as of yesterday, we have 2,049 cases that are active, and over the last 24 hours or so, we would have been able to detect 91 new cases. Of these cases, of the 2,049 cases, we currently have 64 persons in hospital, with 37 of them at the Ocean View Hospital, and 16 of those persons are in the ICU. We currently have, of the 64 persons that we have in hospital, 44 of them require some amount of oxygen. So across the different hospitals where they're located, they're receiving the oxygen. As of yesterday, in terms of adults, we have 394,094 persons who would have received a first dose of a COVID-19 vaccine. That is now approximately 76.6% of our adult population receiving a first dose of a COVID-19 vaccine. Second dose, right now we have 266,127 persons who got their second dose. That is now taking us up to about 51.9% of our adult population getting a second dose. And then we continue to look at the 12 to 17 age category. And so far for first dose, we've had 28,551 persons. That's about 39.1% of that age cohort. And second dose, we have 19,758. That's about 27.1% of that age cohort. One of the challenges that we've been having, not a lot of people within this age group, the 12 to 18 age group or 12 to 17 age group, we have had a challenge with how many persons are coming forward to get the vaccine. So it is an area of concern for us. We have to redouble our efforts with the Ministry of Education to make sure that more of the persons who are at school or within this school age, that they get their vaccination. And obviously those out of school youth that fall within this age category, to encourage them to get vaccinated. One way of doing this is that the parents should help us. If they have a young person in the family and they're not vaccinated, is to encourage that young person to come and get vaccinated. One of the big challenges that we have is that while children might experience a milder form of the COVID disease, in some children they have multisystemic disorders, and this can lead to severe forms of the disease. So it is something that we have to monitor. So children need to be vaccinated to keep them safe. And the Pfizer vaccine is what we are using to ensure that we vaccinate this population. So I want to make a big appeal to parents, to teachers, to influential people in the community to encourage young people between the ages of 12 and 17 to come out and get the vaccine, because we need to up these numbers if we are going to protect the children within this age category. Pfizer has signed an agreement with the WHO Patent Production Office where they are allowing use of the technology for countries to manufacture this pill. We don't have manufacturing capacity in the public sector for pharmaceuticals, but here in Guyana there are private companies that would have the manufacturing capabilities. So if those companies work with the WHO Patent Office and are able to bring that particular medicine to Guyana, it is something that we will want to procure. If that does not happen, because it would require a lot of investment to make sure that you're producing this type of medication, if that does not happen, then certainly with the amount of countries now that are going to be producing this medication, that we are certain that we'll be able to get the medicine at affordable price once production has started. So it is something that we are looking at. As I've said before, we have reviewed the efficacy of the medication. It seemed to be working quite well, and therefore as soon as it's made available and it's licensed, then that's something that we'll want to look at, and it's certainly a medication that we'll want to add to the meds that we already have been using to treat COVID-19.
You have been watching today's COVID-19 update for Thursday, November 18, 2021. I'm Natasha Smith-Thomas. Goodbye.